Phoenix Audio presents
Medical Makeover by Robert M. Giller, M.D. and Kathy Matthews. When Jack L. first came to see me, he seemed like the last person you would find waiting anxiously in a doctor's waiting room. There was, after all, nothing really wrong with him. In his mid-30s, he would no doubt be considered a healthy man in the prime of life. But Jack was facing some big changes in his life, and he was worried that some minor symptoms he suffered from would become worse, and he simply couldn't afford to have that happen. Jack had just begun a demanding job in a new company with increased responsibilities. He had also just separated from his wife and moved into an apartment in the city. He was visiting his children as often as he could and keeping up with the social demands of his work, but he was beginning to feel worn out. He often had afternoon headaches. He knew he needed to lose some weight. He hadn't really exercised, since college, when a wrestling injury had given him a chronic weakness and regular stiffness in his neck and shoulders. Jack was also finding that the entertaining he had to do in connection with his job meant that he was drinking more than he would have liked. He was having up to 6 cups of coffee a day just to keep going. He was starting to feel run down, and he knew he couldn't continue at the pace he had set if he weren't in optimum health. Jack was at a turning point. His fast-paced lifestyle was encouraging bad health habits, and he knew that if he kept them up, his health would suffer and he wouldn't be able to handle his responsibilities. He was at the point where his habits were about to turn into addictions. I use the word addictions advisedly because that's precisely what our bad health habits become when they are repeated over a period of time. Jack, however, had not yet turned that corner. Jack represents a new and very welcomed kind of patient. He knows that if he ignores his health and lives with stress, a poor diet, no exercise, and too much drinking, he'll feel the effects, and his personal sense of well-being, as well as his ability to achieve success at work, will suffer. Jack knew all this, and so my job was almost half done. He just needed to know how to begin a program that would eliminate his bad habits and replace them with good ones. He needed more than a list of things to do and not to do. He needed an intelligent, effective method of accomplishing his goals. Today, Jack says he feels 10 years younger. He has more stamina than he would have thought possible. He's lost weight, and the combination of the exercise program he's adopted and the weight loss have given him almost complete relief from his nagging shoulder pain. His afternoon headaches are gone. He's able to eat out with his clients and not damage his health. He's handling the demands of his new job with more energy than he had when he first started the position. His personal life is unresolved, but Jack says that just feeling in the peak of health makes him feel optimistic and in control of his future. Jack's transformation is typical of the changes I've witnessed in patients.
Sample complete. Ready to continue?